Well, for the first time ever, federal regulators are suggesting adults get screened for anxiety disorders. And new research shows a possible link between vaccine hesitancy and traffic crashes. Joining us with more information on today's health headlines is our medical correspondent, Dr. Corey Hebert. Thank you so much for being with us.
Thank you. Thank you.
Let's start with
Wait.
Okay, go ahead.
Let's start with the fact that this bow tie is just eerily similar to my faculty group over at that LSU School of Medicine. Congrats, guys. Okay, go ahead. I'm sorry.
Now with the bad news. We want to talk about a report on diabetes cases. The number of people with diabetes is expected to double by 2050?
Yes, so the issue is this, and this is related to the LSU win last night. Why? Because of all those Jell-O shots. Those Jell-O shots. We have got to lose some weight, folks. We've got to. The federal recommendation by the U.S. Task Service, U.S. Preventive Task Service, we have to show that in America we are losing a lot of. Wait, you know what? We're talking about screening for anxiety.
Oh. I think we're talking about diabetes first.
Okay, all right, there we go. All right, I just see when you get worked up. See when you get worked up. All right.
Go Tigers! We're talking about Jell-O shots. We got it all.
Exactly. Okay, so we have to recognize that folks are gaining too much weight, right? And so everybody in America has to lose it because the type 2 diabetes rates are through the roof. By 2050, we're going to have so many people. Now, if you think about this, you see all these dialysis units popping up around the United States, and even in a lot of areas that in New Orleans. And what we have found is that when you have a diabetes, you're going to have heart problems, kidney problems, eye problems, nerve damage, all types of things, right? So we have to remember, by any means necessary, everybody has talked about Ozempic and all these semaglutides. You have to lose the weight, because if you lose weight, you can reverse your type 2 diabetes, folks. You can reverse it. And if we're doubling the amount of people with diabetes, this is an emergency. So please, when you're out there, by any means necessary, we have to lose weight, and you got to get off of all those Jell-O shots, like I mentioned, and all of those high fructose corn syrups and all that stuff. We got to do it.
It's probably sugar-free Jell-O.
That's what you think.
Just kidding.
And speaking of the anxiety.
Yes, let's talk about that. Okay, so there is a federal recommendation by a U.S. task force that all adults should be screened for anxiety disorders?
Yes. Now, I think it's because of FOMO, fear of missing out in the 24-hour news cycle. I think that's what is causing a lot of this stuff. But this is the first time 19 through 64 years of age folks have to be screened for anxiety by their primary care. And the reason why is because we see that there's a really big link between anxiety and depression, all right? And when you see that link between anxiety and depression, you start understanding that you have to think about how you are living your life. Are you having these overwhelming feelings of being scared and having all these panic attacks, increased heart rate, respiratory rate? But the key to this is, does it affect your anxiety level in a way that stops you from doing everyday life things? Are you changing the way that you go to work because you are not having issues, or you're having issues with your heart rate and sweating and all these types of things? You've got to get on some therapy, and you got to get on some meds. But right now, there's so many people that think that they're just, worrying alone. You got to get to the doctor, but now we're going to be screened for that. And people over the age of 65, we have an urgent situation with them, because we haven't had the data yet to show that they have an increased risk, but we do know that they do have an increased risk. So please, folks, therapy and or medicine if you are having a change in your life where you cannot get to your everyday life activities because of this anxiety.
All right, we have less than a minute, but this is so important. Okay, there's a study that found a link between vaccine hesitancy and traffic accidents.
Now, this is no judgment, but I'm going to read this because it's very important. This is no judgment. However, 11,270,763 people, they had 16% had no vaccine, 84% did have a vaccine, okay? So of those people, they had 6,682 crashes, and 25% of the crashes were by the unvaccinated people, which means it was an increase of 72% risk if you were unvaccinated to have an accident. So like I said, there's no judgment, there's apolitical. What I'm saying is, if you did not get a COVID vaccine, you have a 72% increased relative risk of having a traffic accident. And I'm telling you, The traffic in New Orleans is horrible right now. It is horrible. And so I didn't understand why, so I looked this up. And I think this may be the reason. There's lots of reasons that you could postulate as to why this is happening, but.
That's very, very interesting. Okay,
Go
Dr.
Tigers.
Hebert.
Go Tigers.
Thanks, Coach O. Dr. Hebert visits us every Tuesday on the Eyewitness Morning News. If you've missed his previous updates, you can get his expert opinion on our app, YouTube page, and on our website, WWLTV.com.